To avoid serious complications, you should only inject nasolabial folds in one of three ways that I'm going to explain. As we know, the facial artery is a branch of external carotid, and when it comes to the face, closer to the surface about here, it becomes an angular artery, and then it anastomoses with a dorsal nasal artery along the nose right here. Dorsal nasal artery is a branch of ophthalmic artery which connects to our internal carotid. The problem is when we inject in nasolabial folds, we come in a very dangerously close proximity to the angular artery, which here can have a variable pathways. Compression of the angular artery here will lead to necrosis of all the areas that it supplies. Even worse complication can result from emboli, because that can travel along the dorsal nasal artery, leading to necrosis of the nose, or even going to be affected some of the areas of the ophthalmic artery and potentially compromising the vision. To avoid this complication is to inject very minimally right at this area right here. And the way that you can do that is you can actually inject with a needle, like a little bit of fanning pattern here, of course aspirating with each needle stick. But the fanning pattern will create a little bit of platform here as opposed to big glob of filler, and this will allow you to inject smaller amounts and still have really nice nasolabial correction. Other two ways of minimizing risk is injecting perpendicular to the skin down deep to the periosteum and create deposit injection here. Because the angular artery will be going more superficial, that deep deposit is pretty safe to do. Last but not least, you can use a cannula, and your place of introduction will be far below the danger zone. So when you are here by the nose, as long as you're not overfilling this spot, it should be also pretty safe. Comment more if you want me to cover in the next video the danger zone in the glabellar and the temple area.